Hello, everyone. So this chapter is on communicating with patients. I want to be clear that this is not an interview chapter based on interviewing for a role of a job. This is interviewing patients. So how do you communicate with patients in the hospital? How do you translate your career as a RAD tech into effective communication with patients? There's a lot of detail that goes into this, and this chapter highlights the majority of that. We're not going to spend a ton of time on the lecture. I feel in this chapter you're going to get more information on research and videos you can find online, but everyone has an effective style of communication that they can use personally, and not every form of communication works for everyone. So I don't want to kind of shout out the golden rule here with communication, but there are some concepts that you can utilize to make your process a little easier. So this is a good video for you as a RAD tech to watch. I would recommend you pull it up. It shows information about an effective process of gathering information with your patient. So what's the primary role, of course, of a medical interview when you're asking for information from the patient? Of course, the gathering of that information and building a relationship. And of course, on top of that, educating the patient. Some of this, of course, will be more on a provider's hands, but at times there are ways you can effectively communicate with a patient and give them the proper tools to be successful in their process. Common interview approaches, of course, you have a primary care provider approach, and then you have a team approach. There's a little bit of difference here. I won't really go into a ton of detail here, but primary care also has a provider to patient approach, but they at times have team approaches too. So it's not just specialists that have for example, a cardiologist that'll see a patient only once, and then the majority of the rest of their care is through a physician assistant or a nurse practitioner. Primary care offices also do this with PAs and nurse practitioners, so there's a little bit of a concept here that probably should be updated. In general, of course, the patient is your source of medical information. You're not going to gather much outside that unless the patient comes in with an electronic health record or a health record that is fully up to date, but the patient usually provides the information you need to be successful in the process or the care that you're going to give them. Family members at time can help communicate what a patient can't, especially if the patient is under a diagnosis or treatment, or at times, in a challenged state. So the majority of the time, of course, it's a doctor's office, clinic, or hospital. However, you're probably not going to deal with this in radiology as much, but nowadays with all the challenges of COVID, there's a lot of virtual care going on. So a lot of times you'll encounter telehealth patients, and they'll be, of course, over video, and they could be in their home or another location communicating. We've had people communicate from the park. We've had others communicate from the basement. It just depends on where they can get, service to reach out to the provider and ask questions that they need or have the visit that they so desire. Telephone interviews, that happens at times here, but people are really shying away from that now to move towards the video side of things, just because it's better for both the patient and the provider to be able to see and provide face-to-face contact, at least over a video screen. Be sure when you're talking to a patient you don't ask closed questions. So a closed question is anything that could answer in yes or no. So did you drive here today? That would be a closed question because they can answer in yes or no. You could go into more detail and say, how was your drive here today? Or what process did you take to get here today beyond just a car? And they could go into a lot of detail there based on what you need in your evaluation of the patient. That's what you call, of course, an open-ended question. And I would assume that the majority of you know the difference between a closed and open-ended question, but be sure to read over it, and more information, of course, in videos out there that can show you how to effectively communicate with patients. But the majority of the time you want to communicate with patients on their level, rather than talk over their head. And a lot of times this is not using a lot of medical language that we're all aware of. The majority of people don't know, all the bones and joints, of course, in the body. You want to be able to show them what exactly is impacted and not talk on a level that kind of flies over their head to where they don't understand. That's not going to be an effective practice of communication. This talks about a little bit of cautionary issues with open-ended questions and the reason why we use them. Feel free to read that. Indirect statements, that's another type of communication that helps, therapeutic process, but be sure to look at that when you have time. Healthcare provider-centered interview, we talked a little bit about streamlined questions. A lot of times it's a checklist that the provider will go over. You'll probably have this in your career where you need to go through certain questions, and I'm going to be up front. You'll probably only have a certain amount of time to be with the patient, and that can be at times challenging. And I think we review that here in a bit. But some of the more important information that I would receive from a patient at times would be in a very short visit. So you might only have 10 to 15 minutes depending on what setting you're in, especially if you're in a clinic. So you want to make the majority of that time successful, and at the same time you want to stay on task because you have other patients waiting. So relying on your caregivers that are around you to help, ease the way per se. So if you have an MA that helps you with the rooming process, maybe the MA can pull you out of the room when time's up. Or maybe you can learn how to end a conversation rather than have the patient continue on. And a lot of times patients come to a provider's office because it's their only source of communication with others. So this at times can be challenging to end a communication process that might be beneficial for a patient in the long run. Sometimes it can be worth it to stay longer and be late, but other times it can be more of a challenge for the rest of your day and the rest of the patients waiting on the schedule. So it's a fine balance. I'm not saying there's any, kind of rule here to manipulate a schedule or to manipulate a communication process. So AIDIT's a really good tool that a lot of hospitals and healthcare systems use to communicate effectively. It's an interview guideline. It's acknowledge, introduce, be sure to make sure you have duration, explain your process, and thank the patient. So that'll increase safety. You want to introduce trust when you introduce yourself, your duration of your talk. Of course, I talk about that, 15 minutes potentially. And then, depending on, of course, what situation you're in. And then increase compliance by explaining who you are and why you're there. That's very important. So, hi, my name is Patrick Williams, and I'm a healthcare administrator for this hospital, and I'm here to just ask how you're doing today. That would be an effective process in AIDA. And then when you're done with the communication, thank the patient for their time and tell them that you appreciate working with them. I would keep this kind of in your process as you go along. AIDIT's a great tool. All right, chief complaint, presenting illness. Read over this. This is something that a patient will oftentimes pull up, but the majority of this would be based on the provider's principles. And then interviewing children can be a little bit more difficult, but there's some differences when you have to rely on a parent, make sure the parent has filled out the proper paperwork to speak for their child, etc. And then legal restrictions are a part of this. You don't want to ask questions that might bring up legal issues with patient care or legal issues that shouldn't be discussed. If you're there for a certain visit, you need to stick to that visit and not try to go out on the deep end in regards to beyond what the provider has ordered to happen. Legal restrictions, of course, we talk about HIPAA. Hospitals and doctors must protect against the misuse of patient information that's out there. Read over this and watch this video. I think it can be helpful. Realize, though, too, there's a lot of differences in what is protected, especially when parents are there with children. If a child is being seen for a certain thing like mental health or for children being looked at for sexual health, there are protections, and the patient can actually be seen if they're a child under age of 18 without parent or guardian notification, depending on what the child wants in that situation. So a lot of differences out there. So be sure to be aware of those, and I'll try to post some information based on HIPAA and some of the regulatory guidance that we're all aware of. But I'm not going to bore you too much longer with a lot of this information. I know we talked about some of the differences here between communicating effectively with patients and of course ineffective communication. Reach out if you have any questions. I appreciate all your hard work. Be sure to watch the videos in this module because I think that'll be the most helpful for you moving forward, and read over the material that I post. Thanks so much. Hope you have a good rest of the week.